Hey guys, Dr. Kilfoyle here. Like and subscribe. Right now we have a patient, HC. She has an ingrown nail. We've done a previous phenol matrixectomy on her before. However, now she's having some pain in the back corner right over here. What we want to do is we want to make sure that there's no spicules that are left on the side because she's having some continued pain. This is unfortunately one of the complications that can happen during a phenol matrixectomy, is that not all of the matrix is actually destroyed by the phenol, and little tiny jets of nail could be poking out over here. So we're gonna start off with a little bit of local anesthesia. Just breathe, relax. We're gonna do cold spray first. Okay. And this is slow part right here. You're doing great. So it should be numb in about 10 seconds. So I add a little bit more than other people may on my phenol so that this doesn't happen. But some people just have a very hardy nail germinal matrix, and that can lead to situations like this. I'm hoping I don't see any spicules. I also add a little bit more lidocaine than may be necessary to add a tourniquet effect to the situation so I can see better without blood getting onto my field. So you'll see I'm going to really let it go and expand here. It's not only going to make her numb, but it's going to make it easier for me to see. That redness is betadine when I sterilize the area. She's doing great. I'm going to do a little bit more anterior, just make sure I get the tip of the nail. Nice and slow. I think I use a slow infusion so it's less painful, though it's never going to be non-painful. Very good. Okay, so we're going to use our first instrument called a spatula. I'm going to take the nail off from where it's attached. Here, you feel any pain, you let me know, okay? I'm going to sweep medially, or excuse me, laterally. Okay, now we're going to use something called an English anvil. We're going to clip what potentially is the offending piece out. Now I use a beaver blade to get this last little bit out right here. I see I'll put some pressure on it to twist it away. And let's take this last little bit out. For a lady, I like to leave as much nail as possible so that it has a cosmetically appealing look to it. Otherwise, you're going to stake the nail and she'll never want to show her foot off again. That's it. So this is how much nail was hiding in there. So I'm inspecting to see if there is a little spike there. There wasn't. It's just a little bit extra wide there. It'd be at this point that we would add more phenol if she was into that. Is that something you want to do? This would be with the permanent, we could let it grow back and see if it comes back. Okay. I think that might be okay. If it does come back, we could always do it again. You're a good patient. And that'll make it so that it's, give us the best chance to not have to have a stake nail. Okay? And that's it for today, guys. We'll see you next time. Thanks for watching.